you all for coming to my session, Bacterial Meningitis, My Little Boy's Fight for Survival. My name is Hampshire, and I'm here to tell you the story about my amazing son, Lucas, and our experience with pneumococcal meningitis. I am the mother of two boys. My youngest son, Lucas, just turned 4, and my oldest son, Ben, will be 6 next month. I'm also a registered nurse. I've been working as a psych nurse for most of my career, but I also have experience taking care of patients on a cardiovascular surgical unit. I'm standing in front of you as a nurse, but mostly as a mother, to tell you the story about my son Lucas and how he fought for his life against pneumococcal meningitis. Please note that I am not a public speaker, so please bear with me. And I also make jokes when I'm nervous, so feel free to laugh at those. And I'm very nervous because this is a large crowd. On Thursday, November 19th, it was a day that started out like any other. Lucas and Benjamin went to daycare. Lucas was 20 months old at the time. Ben was almost 4 years old. My husband Jamie and I each went to work. That evening I left work early because I wasn't feeling well. I went to urgent care and I was diagnosed with an ear infection. I picked up the kids from daycare at 5:15. The daycare provider said that Lucas wasn't feeling well and that he had been tired and clingy that afternoon. On a side note, Lucas was a very clingy kid. The daycare owner affectionately nicknamed him her third kidney because she would have to hold him on her hip all the time because he wanted to be carried around. Right before I got there, he had just vomited twice. She checked his temperature and he was 102 degrees. Not that big of a deal, kids get sick all the time. Lucas seemed to be feeling mildly ill at home. He was drinking Gatorade like a champ, so I wasn't that worried. He didn't eat supper that night. We snuggled for a while and then he went to bed. There was certainly nothing alarming about his presentation. No rash, no change in mental status, no light sensitivity, no neck stiffness. He woke up crying at some point during the night, so I gave him Motrin and he went back to sleep. The morning of Friday, November 20th, I woke up early, called in sick to work because both Lucas and I were not feeling well. Lucas slept late that morning, which is unusual for him. So I went in and woke him up at 8:30. He had diarrhea and a fever of 102.9 when I woke him up. I gave him Motrin and we snuggled on the couch and watched TV. He drank purple Gatorade and took a nap on me. A while later, he felt really warm, so I rechecked his temperature and he was 103.9. I started to get really nervous because he had never had a temperature that high before. I called his pediatrician's office and they scheduled him for 11:20. I put him in the car to bring him to the pediatrician's office and he projectile vomited purple Gatorade everywhere. I cleaned him up as best as I could and we were on our way. The pediatrician's office was less than a 6-minute drive from my house, but it felt like it took forever to get there. That's when he started to decline. Lucas had that glassy-eyed, sick kid look, that look that kids get when they have a fever and you can tell they feel miserable. But on top of that, he was very tired and weak. We saw Lucas's pediatrician, who is absolutely wonderful. She is here today, by the way. She did a very thorough examination and swabbed him for strep, which was negative. She calmly explained to me that I needed to take Lucas to the emergency department and that she would call them to let them know that we were on the way. It was less than a 10-minute drive from the pediatrician's office to the emergency department, but it felt like an eternity. I called my husband and told him to meet us at the hospital. As a nurse, I knew that his clinical presentation was consistent with that of a stomach virus, that he was probably just dehydrated and that he would perk right up with some IV fluids. But as a mother, I was panicking because neither of my children had ever had a fever that high before, and he just didn't look right to me. When I took him out of the car in the hospital parking lot, his level of decline was shocking. He was floppy. 10 minutes earlier, he was responsive, and now he was a rag doll in my arms. I ran inside the emergency department and they took us right in. The nurse put Lucas on the cardiac monitor. She said that his heart rate and blood pressure were both low. She said that his capillary refill time was slow. His limbs felt cold. She drew labs, blood cultures, and started IV fluids. Lucas didn't wake up or open his eyes with the needle stick. That's when I started sobbing. I was able to keep it together up until that point, but when he didn't open his eyes during the needle stick, I knew that something was very wrong with my little boy. My husband arrived at that point. He is an engineer and really has no understanding about anything medical, which is a blessing and it's a curse. Our nurse called the nurse's station from the phone in our room and asked the charge nurse to have somebody else cover her patients because she was going to be in here with us a while. The doctor said he did not know what was going on with Lucas because he was unable to find any obvious source of infection. He was very personable and calm. He kept calling Lucas Shorty and talking to him, even though Lucas clearly was not able to hear him. The doctor came back with the initial lab results and said that Lucas's white blood count was 23 and that they were starting him on an IV antibiotic called Rocephin in case Lucas had a bacterial infection. The nurse got a urine sample from Lucas via straight catheter. Lucas opened his eyes for a brief moment and then closed them again and went right back to sleep. The nurse said she was really hoping for more of a reaction from Lucas. After 2 bags of IV fluids, she said that his vital signs stabilized. I contacted my family to let them know that Lucas was in the emergency department and that I was really scared. That my baby boy was laying lifeless in my arms and that I was completely helpless in doing anything about it. I really wanted to talk to my mom, but she and my stepfather were in the Congo doing missionary work for the entire month. As part of the sepsis protocol, they needed to do a chest x-ray. The x-ray technician wheeled Lucas and I down to radiology. The technician asked if Lucas could stand for the x-ray. I had to explain that Lucas could not even hold up his own head. They had to prop him up against my body with lead aprons between us. The doctor said that the chest x-ray was negative and that he was admitting Lucas to the pediatric unit because he was shocky. I didn't realize it at the time, but I think that he was referring to the fact that Lucas had septic shock. Upstairs on the pediatric unit, Lucas laid lifeless in his crib, wearing only a diaper, a cardiac monitor, and his IV. We watched his Sesame Street DVD over and over again. Sesame Street was Lucas's favorite TV show at the time. Somehow I thought that Lucas would hear it, wake up, and want to watch it. It was a really old episode. Stephen Colbert was the guest star, and he was dressed as the letter Z. He was trying to talk to people at the mall about the alphabet. It's really weird the things that you remember. The nurse came in to say that they had no idea why Lucas was so lethargic, and they wanted to run a drug screen on him. My first thought was, oh my God, they must think I drugged him. I texted my friend, who also is here today, who was able to calm me down by telling me a story about how she ate an air freshener out of a diaper pail when she was Lucas's age. And that kids do indeed get into weird things, so of course, they should run a drug screen on him. My husband had gone home at that point because only one of us could spend the night. Our older son Ben was sleeping over at my father's house that night. At 10:30 p.m., the doctor came in and said that the preliminary blood cultures that were drawn that afternoon came back positive for a bacterial infection, and that the fact that they resulted so quickly speaks to the severity of the infection. He immediately ordered IV vancomycin and increased the frequency of the IV Rocephin. He said that it would be prudent to do a lumbar puncture immediately to check for bacterial meningitis. I called my husband and he was back at the hospital in minutes. The doctor gave us the option to be present during the lumbar puncture or to wait in the hallway. I did not want to be present, but my husband did, so we stayed. They gave Lucas intranasal Versed twice, which I didn't even know was a thing. As soon as he was moved into the arched back position, he became more agitated than I had ever seen him. It took 2 nurses to restrain him. He was clearly in pain. He was crying. It was the saddest, most heartbreaking cry I have ever heard, and at the same time, it was a relief to hear him make a sound. The silence before that was deafening. It took 2 tries for the doctor to successfully do the lumbar puncture because Lucas fought him. When I saw the cloudy spinal fluid, I thought that I was going to die. Looking back, I cannot remember if I just emotionally crumbled to the floor or if I actually physically crumbled to the floor. I remember feeling angry at my husband because he did not know what cloudy spinal fluid meant. I was angry that he still had a few more minutes of blissful ignorance before he would know that our baby boy had bacterial meningitis and would probably die, or lose his limbs, or be severely brain damaged. The doctor finished the procedure, and I stood there in silent despair. Lucas's level of agitation had decreased once he was no longer restrained, but he continued to cry. The lights were bright, and he was clearly bothered by them. This is when the more typical signs of meningitis started to appear: stiffness, agitation, and light sensitivity. The doctor explained to us what I already knew, that the cloudy spinal fluid suggested bacterial meningitis, and he was confident that the lab would confirm that. He suspected pneumococcal meningitis, but again, we would have to wait for the lab to confirm. In the meantime, he called the Infectious Disease Department for confirmation of the best plan of care, because he said that he had never seen bacterial meningitis before. He said, quote, "I'm 37 years old, and I started practicing medicine after the age of vaccines," end quote. Until the lab came back with what antibiotic would best treat his meningitis, they had him on IV Rocephin, vancomycin, and rifampin. I begged the doctor to please give us a prognosis, but he was not able to. He said we would just have to wait and see how he does over the next 24 hours. The next morning, he was transferred to the pediatric intensive care unit because his sodium level was off, and he had syndrome of inappropriate antidiuretic hormone, which they said was from the meningitis sending mixed signals from his brain to his body. Lucas was very agitated at this point. He absolutely could not tolerate being touched. He could not tolerate any lights or sound. So we sat there in the silence, in the dark, and unable to touch him for 2 days. In the silence and in the darkness, I had a lot of time to think. How could this happen? Why was this happening? How could my beautiful baby boy get bacterial meningitis? Was he going to die? Was he going to live? Would he have brain damage? Would he lose his limbs? And was this my fault? In the darkness and the silence of that ICU room, I went through many stages of grief. I was in denial. I was angry. I was bargaining with God. I was helpless and I was in despair. He was awake, but he did not recognize us. All of my medical knowledge could not help him. We asked the doctors his prognosis, but they did not know. They all said we would have to wait and see how he does over the next 24 hours. But you said that 24 hours ago, I thought. At some point during that time, he got a PICC line. The labs came back confirming that it was pneumococcal meningitis and that Rocephin was the best antibiotic to treat it, so the other two were discontinued. All I wanted to do was to hold my sick baby, but even gently touching him caused him an agony that was unbearable. Why didn't he know me? How could he look at me and not know that I was his mother? How could this have happened? On the afternoon of Monday, November 23rd, 3 days after he was admitted, my son looked at me and he recognized me as his mother. It was one of the happiest moments of my life. He did not say anything, I just knew that he knew me. He had life in his eyes. I called for the nurse and she got the doctor. At that point, I knew that my baby was going to live. He rapidly improved after that. As quickly as he declined was as quickly as he improved. It felt like a miracle. We were transferred back to the regular pediatric unit the next day. Within a few days, he was eating, playing, and watching TV. He was back to normal. He was my Lucas again. Our nightmare was finally over, or so I thought. We were discharged home on November 30th, 10 days after he was admitted. He still had a PICC line, and I was to administer IV antibiotics at home for another few days. As a nurse, I've administered IV meds through PICC lines countless times, but as a mother, it feels differently when you're giving it to your own child. Let me set the scene for you. Trying to give IV meds to an almost 2-year-old at home is like trying to herd chickens. The antibiotic came in this weird Christmas ornament looking bulb. Lucas wouldn't sit still. He was feeling well enough to run around the house and play, which was great, but not when you're trying to administer IV medication through a PICC line. He was trying to tug at the PICC line. It seemed to take forever for it to infuse. Lucas wanted to play with the bulb. The whole thing was really anxiety-provoking for me, and I'm a nurse with lots of experience with PICC lines. But again, it's different when it's your own child. And then came the fevers of unknown origin. The day after Lucas was discharged home, he had a temperature of 100.4, which under normal circumstances is nothing. But when you have a PICC line and you're getting IV antibiotics for bacterial meningitis, it's very concerning. He was readmitted to the pediatric unit. All of the testing was negative, the fever resolved, and after another 2 nights in the hospital, he was discharged with a diagnosis of fever of unknown origin. 2 days later, the VNA nurse came over to remove the PICC line, but she was not able to because Lucas had another fever. We were sent back to the emergency room where they removed the PICC line, cultured it, did another workup which was negative. We were discharged home with another fever of unknown origin. 4 days later, we were back at the emergency department with another low-grade fever, this time with lethargy. Other than that, everything else was negative. He perked right up with IV fluids and Tylenol, and we were discharged home with another fever of unknown origin. Later that night, his temperature spiked to 103. He was readmitted to the pediatric unit. They did an MRI to check for a brain abscess, which was negative. They did another lumbar puncture, which was negative. They did a cardiac echo to check for vegetation on his heart, which was negative. Infectious disease was consulted again. His fever resolved, and he was discharged after 48 hours with another fever of unknown origin. No one seemed to know why my beautiful baby boy got bacterial meningitis, or why he was getting fevers of unknown origin, or if there would be long-term ramifications from him having bacterial meningitis. And if we didn't know why he got it, how would we know that he wouldn't get it again? I was determined to find out the exact strain of pneumococcal meningitis that Lucas had, but was told that the information was not available because the strain was never tested. I thought that if I could find out if it was an immune issue versus a vaccine issue, that I would be able to sleep at night. We were referred to an immunologist who checked Lucas's titers for the PCV13, which is the series of vaccines he received for pneumococcal disease. That showed that he only had antibodies to 7 of the 13 strains covered under the vaccine. But without knowing the exact strain of pneumococcal meningitis he had, I will never know if it was one that was covered under the vaccine or not. He then received the Pneumovax 23, which is a vaccine that covers 23 strains of pneumococcal disease. And fortunately, his titers show antibodies to all 23 strains. His immune testing all came back normal. We had his hearing tested, and to our surprise, it showed unilateral hearing loss. As a nurse, I know that hearing loss is very common after bacterial meningitis, but as a mother, I was shocked because he didn't appear to have any hearing loss at all. The ENT did an MRI about 6 months post-meningitis to see if Lucas was a candidate for a cochlear implant. During that MRI, they found a very unusual finding, that a part of Lucas's cerebellum, called the flocculus, which I didn't know was a thing either, on the right side of his brain was herniated into his right auditory canal. The ENT had never seen that finding before, so he showed it to the neuroradiology department, who also had never seen that finding before. It's not a very comforting feeling when a doctor tells you they have never seen something before. So we took Lucas in the MRI to a neurologist to get another opinion. We got the same response. So we took Lucas and the MRI to a different neurologist because someone somewhere must have seen this before. Surely my son is not a medical marvel. He is just a boy. We don't need Dr. House to solve this mystery. That is a TV show, and this is real life. The neurologist was very skeptical that his flocculus could be herniated because she also had never seen that before, and she would have expected to see obvious neurological deficits upon examination, which there were none. So she took the MRI disc and said she would give it to the head of pediatric neuroradiology and that she would call me when the disc was red. So she did call me on a Saturday while she was on vacation. She confirmed that Lucas does in fact have a herniated flocculus, which nobody had ever seen before. But she also said that they also saw a cyst in Lucas's right auditory canal that was far more concerning than the flocculus issue. She said that she forwarded the MRI images to an ENT surgeon and that his office would call me immediately to schedule. The next few weeks were a blur. We met with the ENT surgeon who explained to us that Lucas had a cerebral spinal fluid leak in his skull that created the cyst that they saw. That cyst was filled with cerebral spinal fluid called a cranial meningocele, and that he and a neurosurgeon would need to surgically repair the leak as soon as possible. He said that is why Lucas got bacterial meningitis and that it was surprising that he did not get bacterial meningitis again. Within 2 weeks of meeting with the ENT and neurosurgeon, Lucas had a 7-hour-long brain surgery to repair 2 cerebral spinal fluid leaks. They took fat from his belly and bone from other areas of his skull that they mixed with some sort of cement to create patches that they used to repair. It took 11 months, but I finally had my answer. I did not like the answer, but I finally had it nonetheless. I like to show this picture because these cribs are really high off the ground, and even though the sides come down, you have to be like an acrobat to be able to jump into these cribs. And I'm very tall, but let me tell you, it was not easy to get into the crib. The first year after Lucas's brain surgery, he needed to have a CT scan and an MRI of his brain every 6 months. This past October, we found out that Lucas has another cerebral spinal fluid leak that has formed another cranial meningocele in his right auditory canal. It is small at this time, so he does not need surgical repair yet. But he is at high risk of getting bacterial meningitis again. We are working with his doctors to do everything we can to protect him from getting bacterial meningitis because it is a very real danger for him. A few months ago, Lucas received the Menactra vaccine for meningococcal meningitis. Unfortunately, he only made antibodies to one of the 4 strains covered in the vaccine. Last week, he received a booster for the Menactra. I don't know why Lucas is not a great responder to vaccines, but I know that he needs them. And Lucas needs the people around him to be vaccinated to reduce his risk of exposure. Lucas is a great example of the importance of community immunity because he is at high risk of getting bacterial meningitis again because of his cerebral spinal fluid leak. The CDC defines community immunity as a situation in which a sufficient proportion of a population is immune to an infectious disease through vaccination and/or prior illness to make its spread from person to person unlikely. Even individuals not vaccinated, such as newborns and those with chronic illnesses, are offered some protection because the disease has little opportunity to spread within the community, also known as herd immunity. The prevalence of bacterial meningitis has declined because of the efficacy of vaccines such as the PCV13, the Pneumovax 23, Hib, Men-B, and Menactra. Pneumococcus is the bacteria that caused Lucas's meningitis. It's the same bacteria that commonly causes middle ear infections, sinus infections, and pneumonia. It's spread through respiratory secretions such as coughing and sneezing, which means it's everywhere in the community. Let that sink in for a minute, that Lucas could have been exposed to the pneumococcus bacteria by somebody's sneeze. The CDC recommends that the PCV13, which is a 4-dose series vaccine for pneumococcal disease, be given at 2 months, 4 months, 6 months, and 12 months of age. It's been 2.5 years since Lucas had pneumococcal meningitis, and our lives are forever changed. Life has been divided into a timeline of before meningitis and after meningitis. Since then, I've started an online support group for parents and caregivers of children with meningitis. It has 97 members from all over the world. Every time I get a new member request, it breaks my heart because it means that another family is going through the hell that we went through. Some of the families were not as fortunate as we were, and their child didn't survive meningitis, or their child was left with severe brain damage or lost limbs. Many of the stories that I hear from these other families is that they were sent home from the hospital because their symptoms were not recognized as bacterial meningitis. As we all know, early treatment leads to better outcomes, and late treatment leads to poor outcomes. Early signs and symptoms of bacterial meningitis are fever, vomiting, and lethargy. That's exactly what Lucas had, and that's what many of the families and the children in my support group had. Early signs and symptoms of bacterial meningitis in babies are unusual crying or moaning, fever, refusing to eat, and a bulging soft spot on the head. The more typical or classic symptoms of bacterial meningitis are headache, rash, neck stiffness, change in mental status, and light sensitivity. But please note that those are not always present in children, or they are hard to detect. Lucas never had a rash at any point during his meningitis, and at 20 months old, he did not have the language to tell me if he had a headache. Lucas did not have neck stiffness and light sensitivity until later in his illness. I am so beyond grateful that Lucas received early treatment. Every minute counts with bacterial meningitis. I replay that day in my mind over and over again, and if anything went differently to delay his treatment even by 20 minutes, the outcome likely would have been different. I am grateful for the receptionist at the pediatrician's office for giving us a morning appointment instead of an afternoon appointment. I am grateful for Lucas's amazing pediatrician for sending us to the emergency department. If she had sent us home instead, I would have put Lucas down for a nap in his crib and he would have died in his sleep. I am grateful for the compassionate nurse at the emergency department, and I'm grateful for the doctor starting IV Rocephin, which just happened to be the very antibiotic that was most effective in treating his bacterial meningitis. I am grateful for having such a wonderful support system. I'm on the Parents Council for the New Hampshire Partners in Health program, which is a huge support for me. Lucas is a member of that Partners in Health program, which helps with advocacy, resources, and activities for kids from birth through age 21 with chronic medical issues. And that archery photo is actually, that was a Partners in Health activity that we were at just a few weeks ago. The Partners in Health program, they have an information table here today. Every day that goes by that Lucas does not get bacterial meningitis is a victory for us. Every day that goes by that Lucas does not need another brain surgery is a victory for us. People often ask me, how do you do it, living with that fear every day? And the answer is that I just do. Thank you.